Hypertension is an increase in the pressure generated by the heart in the arterial blood supply of the body. Basically, an increase in the force that the heart has to provide in order to pump the blood to the organs of the body. It is a major risk factor for an increased risk of death, heart attack, stroke, heart failure, and kidney disease. But it is one of the most correctable and treatable disorders that we have. It's estimated that 20% of the American population has high blood pressure, but 90% of people over the age of 55 will develop high blood pressure before the date of their death. Before we talk about high blood pressure, well, what is a normal blood pressure? So a normal blood pressure is considered to be a number of less than 120/80. The top number, or the systolic blood pressure, reflects the maximum force needed to force the blood from the heart into the arteries and out to the various organs of the body: the brain, the kidneys, the lungs, the intestines, the periphery. The bottom number, or the diastolic blood pressure, is the resting tension of the blood vessels between heartbeats. And either number might be abnormal to qualify for high blood pressure. There are some special populations that need to be treated to values even below 140/90. So, for example, patients with diabetes would be considered to have high blood pressure at a value greater than 130/80. And that is the same number that we use in patients who have chronic kidney disease. So in these two patient populations, the diabetics and the patient with chronic kidney disease, a value of greater than 130/80 is thought to be hypertensive. What are the causes of high blood pressure? Well, for most patients, it's a genetic disorder. You've inherited from one or more of your parents the genetic composition that leads to an increase in the blood pressure values, generally due to a constriction or narrowing of the blood vessels, so that the heart has to pump harder to force a normal amount of blood through the blood vessels and to the organs. In a small number of patients, a blockage in the artery to the kidney, a tumor of the adrenal gland, or excessive production of various hormones may raise the blood pressure values. In these cases, correction of that blockage or removal of that tumor may correct the blood pressure. But for the vast, vast, vast majority of patients, perhaps greater than 99%, a genetic abnormality is the cause of the increase in blood pressure, and lifestyle modification, perhaps along with drug therapy, will lead to control of the patient's blood pressure value. We control the blood pressure in order to reduce the risk of heart attack and stroke. And it is quite clear that the successful reduction in blood pressure values will lead to a reduction in the risk of heart attack, the risk of stroke, and the risk of death as a result of these high blood pressure values. High blood pressure makes your diabetes worse. It accelerates atherosclerosis, or hardening of the arteries, in patients with high cholesterol. And it is generally, if you will, a multiplier of your risk if you have other cardiovascular risk factors. If you have high blood pressure, if you've been told you have an elevated blood pressure value, discuss the need for treatment with your primary care physician or with a specialist, a cardiologist, an endocrinologist, or a kidney disease doctor, who may be able to help you to control your blood pressure effectively.